Thanks for staying with us. Now, depression is the most common illness that affects mental health. In a global survey, Nigeria ranked 15 in the number of suicide per year. Depression is still a significant public health problem, and at a prevalence rate of 3.9%, 7 million Nigerians currently suffer from it. However, more studies conducted amongst different people or different populations have reported a much higher prevalence in Nigeria. Nigeria ranked 8th on the list of the world's most depressed countries, 9th for anxiety, 6th for countries with the highest consumption of alcohol and drug. With the current challenges we face globally and our internal challenges, how can one maintain a healthy state of mind? Please let us hear what you have to say. Remember, you can join the conversation. Send us an SMS or WhatsApp to 081-803-84663. All right, so before I bring in Hauwa in like a minute, this NSAS thing that you're talking about already, the atmosphere is already charged.
It's already tense.
Do you understand? Nigeria seems to be like a place where everything deliberately points at distorting your mental state.
Even when you try to
keep yourself. Yes, from the people you deal with to the people that are governing you to the people roads. On the roads, especially in Lagos State. I'm not sure about any other state. Everything is just like everything is working against your mental sanity. So that's what I think with Nigeria. And I'm not alone, because if you ask a lot of people, they tell you these numbers are rising. Even with the statistics, we don't even have the full, full numbers here. Because I haven't gone to I haven't gone to go and see a doctor. But I remember there was a time where, if you look at the signs of depression, I think I went through all of those signs, having been dehydrated, emaciated, being whatever, and all of that. But so just tell me, walk me through, how do you think we can even maintain sanity with all of these things that we're going through in our nation today?
Why are you looking at me?
Okay, I think you have to be very deliberate about it. Whatever it takes. Whatever it takes, and I don't mean anything illegal anyway, but whatever it takes. And for me, I always say this: I try to curate the kind of content I consume. Right? Since the ban of Twitter, even though we still enter Twitter, Instagram has been the place, right? But for some reason, I've also had to stay away from Instagram for a while, because beyond what is happening in the nation in terms of news, deaths, everything, a lot of things just happen on social media, and I'm wondering, what kind of world am I living in? Why are these people so comfortably washing their dirty nails in public? Why are they behaving the way they are behaving? And when I cannot understand it and I see myself trying so hard to break it down, I just try to shut down and focus on people who make me happy, people who give me joy, and focus on the contents that give me joy. So I think you have to be really deliberate about it. Absolutely. Know your threshold, know your triggers, know when to stop and when to continue, and be selfish about it, because in doing those things, there are people who would want you to do certain things because they do not understand where you're coming from, or they think that you should just be present. But you have to be able to draw those lines for yourself and try to focus on the positives. It really helps, because if you decide to focus on the negatives, there are lots of them. There are lots of them, and you keep sinking in.
They will always.
So
that's it for me, really.
Well, I guess for me, it just goes to what I had posted this morning on social media, on Instagram, where I said to pause is divine. It was something my mentor normally would say: to err is human, but to pause is divine. It takes you being deliberate, like Elsie said, to take a pause from life sometimes. All of the battering every day, from driving on the roads to what you encounter to the news you hear, all of those things eventually will have effect on your social well-being, your psychological well-being, your emotional well-being. Don't talk about what you even go through, even in your relationships and all. Let's not even go there. But it's important that sometimes you just take a break from life. Take time to regroup, to recoup and regroup yourself, because it's very important. If anything happens to you, life will go on.
Absolutely.
Just
in a simple term, just relax and
be taken care of.
That's just it.
All right, so let me bring in Hauwa. Hauwa Ojeifo publicly identifies as a person who lives with a mental health condition and psychosocial disability, popularly tagged as the voice and the face of mental health in Nigeria. Hauwa has received numerous local and international honors and recognition. She is the executive director of She Writes Woman, an award-winning movement that gives mental health a voice in Nigeria. She is the creator of Safe Place Nigeria, a virtual community for mental health conscious Nigerians to access digital mental health care, self-care tools, and wellness resources. Hauwa is a certified integrative mental health coach, and she is the recipient of the Queen Elizabeth Diamond Jubilee Trust and also the Royal Commonwealth Society. She's a member of the Royal Commonwealth Society. Thank you so much, Hauwa. She's joined us via Zoom live from Abuja. Hi, Hauwa. Thank you so much for joining us.
Thank you so much for having me.
So, what's good? First of all, congratulations. I saw you at a platform. Do you want to quickly share what that was about in France? You're always everywhere when it comes to issues of mental health.
Oh, yes. Thank you. I was, by invitation of the French government, I was at the Global Mental Health Summit to give a keynote on mental health, the state of mental health, on the rights of people with mental health conditions and psychosocial disabilities. So it was really an honor for me to represent the voices of people who have mental health conditions, but also to carry some of the stories from our community here at She Writes Woman and some of the work that we have researched and investigated and documented here in Nigeria around the abuses of people with mental health conditions and what we need to start seeing in terms of changes in the global scene, whether that is how Nigeria affects the world or how the world affects Nigeria in terms of policies, legislation, but also ensuring that we're calling for the right type of investment into mental health care, because we all, always chat, oh yeah, let government to do something. But it's very important to be very careful about the kind of investment that governments or, legislators are making as far as mental health is concerned. So, yeah.
Oh, awesome. Okay. I want to quickly, sorry, just before we go, and I just wanted you to give a background. I was going to ask you, I saw a report somewhere where they say that about 50 million more people have gone into the, what's it called?
Depression.
Not depression, mental health challenges that they have. Okay. 50 million more people. So, I mean, this happened 2020, COVID-19 and all of that. How has that COVID-19 impacted mental health? Then I'll come to Elsie.
Oh, yes. A couple of things, really. For people who had pre-existing mental health conditions, we saw that COVID-19 exacerbated that. Mm-hmm. So being in social isolation, being cut away from the resources and the care that you used to receive, the kind of support you used to receive from social interaction, from access to therapy, access to, your medications and things like that, we found that a lot of people really struggled with that. But that's even for people who had pre-existing mental health conditions. Because I think for the first time, and we saw studies really point to this, that a lot of people around the world saw that for the first time they had to really look at their mental health very keenly. For the first time, a lot of people were experiencing a glimpse of what it was like to live with clinical depression. And so we saw that kind of trend across the board, that people were beginning to see that sense of worthlessness or hopelessness, that sense of withdrawal, overeating, undereating, low mood, and things like that. So it is very possible that, a lot of the numbers really skyrocketed because of COVID-19. There's a lot that COVID-19 has done with regards to our mental health collectively and individually that we're even yet to see the full effect in many years to come.
All right.
Okay, so in the recent speech that you gave, I wasn't opportune to see it, but I saw excerpts on Twitter, and someone was saying that you shared some horrific abuses of rights in mental health services in Nigeria. Can you please share some of those and what is going on in that space?
Oh, thank you. That's a very, very great question. I think a lot of times when we think about mental health and people with mental health conditions, we've been conditioned, really, whether it's in our movies, in our music, in our media, in the news, we'll be conditioned to feel like people with mental health conditions are mad people, crazy people. We have a certain image that comes to mind whenever we hear, oh, somebody with a mental health, condition, someone with a mental illness. And so we have somehow been primed to think of such people as less than. And so we don't really think about the kind of abuses that happen in, places like psychiatric hospitals. From 2018 to about 2020, together with Human Rights Watch, an international non-profit, non-governmental organization, we investigated and reported, documented cases of human rights abuses in psychiatric hospitals, state-owned facilities, traditional healing camps, where, people were flogged and their bodies were cut, and some had holes in some parts of their body because the belief was that if they can tear it open, the evil spirit will come out. We saw government state-owned facilities, and in our own case, we have stories from our community, case in point, the story of Remy, whom, because her mother gave her a phone when she was being admitted into she was forcefully detained actually in a psychiatric hospital. She couldn't have access to her parents, but thankfully she got access. And so her mother gave her a phone, and one of the nurses brought in this heavy built crisis intervention staff that he usually call them, and he held her down and handcuffed her to the bed and pulled her panties out right in the full view of the male guards and all the people within, all the other patients within the facility, just to remove the phone from her, her private parts and, things like that. And we see those things happen, and we tend to turn a blind eye because we've somehow convinced ourselves that, oh, it's people with mental illness, oh, yes, you need to hold them down, things like that. But that's not how an ideal, rights respecting healthcare system should be. But we're seeing that this is what has been norm for so many years within government facilities and even traditional healing camps. People with mental health conditions are forcefully detained. They are tied up, they are beaten, they are deprived of, contact from the outside world. Their personal belongings are taken away from them, and things like that. And it is a real cause for concern. We're yet to see somebody who says that they were forcefully detained and they're better for it.
Wow, this is just so heartbreaking completely. Now, I'm concerned about those that actually take care of people who have mental illness or have to care for them. What help do they really get to even keep their own mental state of mind in place enough to be able to assist those who are clinically diagnosed or something? Is there any form of help that they receive emotionally to help them to cope with what they have to go through as well?
Amazing question, and it's amazing that you think of that, because a lot of times people don't think about who cares for the carer. And carers take on a lot of responsibility, and responsibility because and this responsibility is very disproportionate because of the gaps within the system. You're talking about a system where you have barely 200 psychiatrists in Nigeria to over 200 million Nigerians, first off. And then, scaling down, the numbers continue to get smaller, and it's ridiculous. So we're seeing more and more people having to carry more of the burden. There isn't enough care, I have to say. There is inadequate care for people who live with mental health conditions, and more so for carers who live with mental health conditions as well. So if psychiatrists or, lay counselors or peer specialists or, advocates are having to do this certain type of work with people with mental health conditions, then who gets to take care of them? These same limited resources is what, other carers also have to struggle for as well, to be able to get access to. A lot of that responsibility then has to lie in the hands of the carer to be able to say, okay, fine, I've done, XYZ. I have to take on the responsibility of ensuring that I can do this for the long haul. So I have to take regular breaks and things like that. But in an ideal system, therapists, psychologists, psychiatrists, peer specialists, lay counselors, advocates should be taken care of by the healthcare system as well. But we already understand that we have a very fragmented, dysfunctional healthcare system in Nigeria, also the mental health care system as well.
What you just said reminded me of our former colleague, what's her name, Amaka, that goes around to when there are kidnap cases and she goes to cover those stories. I mean, she had to talk to me one day and say, you know what, that she was so traumatized that they had to get her a therapist. Because hearing those stories of those people that are going through... Hauwa, here's the thing. Nigeria is is almost choking when it comes to issues. If you're not running away from armed robbers, you're running away from bandits. If you're not running away from bandits, you're running away from herdsmen. If you're not running away from herdsmen, you're running away from, what's it called, SARS, or maybe corrupt government politicians and all of that. So if a government is listening and they really want to put our country at the map of better instead of the worst. Instead of the countries with the worst mental health cases, we want to upgrade ourselves to better healthcare, better mental health status, for the country. What should the government be doing? What are they supposed to put in place?
Quite a number of things, really. I think there are different approaches. You can do a top-down approach, a bottom-up approach. You can take the sideways. So if you look at the top-down, we have to recognize that Nigeria's last piece of mental health legislation was in 1958. And I need people to really think about that. If a piece of legislation was from 1958, I think that was around the colonial time. And so that means that there are certain kinds of references and phrases and frameworks that are so outdated and archaic that it only makes sense that they are quite abusive, and it makes sense that we're seeing the kind of system that we're seeing today. But it's not enough that we just say, oh, you know what, let's just change the legislation, because we don't want a situation where we're just doing the same thing but dressing it up with a different type of language, or, but the same sort of practices are going in place. So one of the things that we have done as She Rights Woman over the last year and a half is really pushing for a rights-based approach. There are conventions, human rights conventions that Nigeria has committed to internationally, but we're yet to see them reflect locally. I mean, Nigeria committing to the CRPD and saying that, okay, you know what, all people with disabilities and all people with mental health conditions must be treated with full dignity and liberty and must have their fundamental freedoms. And then you look within the Nigerian society and you're like, really? Nigeria committed to that? Then how is that happening here? Because we haven't localized or fully domesticated those conventions and treaties. So there's that approach. There are policies. There are outright executive orders that can be taken to ban certain things like shackling and chaining and all of those things that happen within the mental health space. Now there's also the bottom-up approach. You can look at what's working within the civil society sector. She Rights Woman has run a 24/7 helpline for the last 5 years. This year alone, we've logged over 7,000 calls. And that is more than we did last year and the year before combined. So it tells you that there's a need. So the government should be looking at how can we scale the things that are already happening? How can we partner with existing organizations to ensure that these services are reaching the furthest behind so that we don't leave anyone behind? Now, when we look at middle ground or sideways approaches, we're looking at social determinants. The truth is that we cannot talk about improving the mental health of any country without really looking at things like poverty, affordable housing, job, employment, education, healthcare. Those are things that if we're going to ensure that people are well, are whole and rounded human beings, then you have to ensure that they're getting good education. You have to ensure that they're getting healthcare, insurance. You have to ensure that there's a safety net for people who are falling below the poverty line. Because really, what use is therapy for somebody who can't afford to eat? Right. So those are certain things that you want to do. It's a very holistic approach. It's not enough to just say, oh, we're going to pass this bill, we're going to donate this. Those are very tokenistic, and we see that happen a lot. Yes, they may create a certain kind of shift, but they're not sustainable, and they don't do us any good in the long run.
Absolutely. Absolutely. Okay. Let's go for a very short break. When we come back from the break, I'll take your question, Elsie. Stay with us. We'll be right back. All right, so if you just tuned in, we're having an amazing chat with Hauwa Ojeifo on maintaining a healthy state of mind amidst the current national challenges that we're having. All right, so please let us hear what you have to say. Remember, you can join the conversation. Send us an SMS or WhatsApp to 081-803-84663. Elsie, you had a question before we went on a break.
Yes, I did. And I understand the place of policy is the place of government, but I'll try to stay away from that for now to stay in line with the topic. That's maintaining our mental health, right? For Hauwa, when she was responding to my question earlier, she talked about some horrific things that were happening. And it reminds me of the conversation we've had over the years in terms of demystifying mental health for people to really understand what it is about. This is not saying you have to understand it like the practitioners, but you just need to understand it enough to have empathy, right? And my question really is, you said you've been doing this for 5 years. I've worked with organizations that are chanting this cause and they've been doing it for that long as well. What more do you think can be done for people to really understand mental health and maybe a bit of how it works in order to have a bit of empathy? Because you've talked about the problems we have in this country. It would also always trigger mental health issues. But how can we begin to break down these things? We have done enough, or we've done a lot in the space of 5 years or more. What more can be done?
Thank you. See, a lot more can be done. On the one hand, we have to look at the role of media. If we're just looking at how we can, as citizens, continue to destigmatize, we have to look at how to continue to have conversations. How can we begin to tell new stories around mental health? Because the way people respond in terms of their attitudes and beliefs and actions around anything that is mental health tells you a lot about the conditioning that we've had. So we're very worried and scared about it. So the moment you say mental health, you've never even said anything illness or disorder or anything. Everybody's like, no, it's not me. It's not me. I'm fine. I'm okay. So we lose a lot of people at that point because we've made the conversation so technical and so complex. But when we really just bring it down to the basics, mental health is how you think, it's how you feel, how your thoughts and your emotions interact, and how that affects your behavior and how you show up every day. If you talk about things like sleep and how people stay in bed and they cannot fall asleep, or how they sleep and they cannot stay asleep, or how they sleep and they wake up early, people begin to be like, yes, I understand that. And those are ways that we can bring more people into the conversation. We don't have to keep mental health we don't have to keep it in terms of disorders and illnesses all the time. We have to talk about wellness in the holistic sense of it. We have to talk about the impact of food and nutrition and good sleep and exercise and physical activity and having a good social circle and the impact of connection, true belonging, and things like that. I think it's very important. I think there's a role of media in telling new stories and highlighting things that are not always about the illness and, what people with mental health conditions did that are bad and things like that. We need to continue to project new images and new stories so that people subconsciously can begin to replace the picture that they have in their heads about, who somebody with a mental health condition is. I think that goes a long way in bringing down the barriers to which people can say, okay, maybe I have something that perhaps I should, that begins to start the conversation. I think beyond that, there's so much that we can do in terms of schools. But again, to scale such things, of course, we're going to have to need policies and governments to scale. But wherever people are, schools and workplaces, you're going to need to start having conversations about mental health. I genuinely believe that one of the ways that we can start to catch it early when it comes to mental health or mental health conditions is recognizing that more than half of mental health conditions are already formed at the age of 14. So it tells you that there's a lot that happens pre-14 that we need to take advantage of in terms of the schooling and how we can begin to revamp education, but also how we can also think about parenting. There's a lot about parenting that we think, oh, that's just how we're brought up. We turned out fine. We're Africans, things like that. But the truth is that it's not working. We start seeing the onset of the breakdown of a lot of people from 24, 23 and upwards, because those are things, and we see the data that it takes about 8 to 10 years from the onset of a mental health condition to when it begins to show behaviorally and interfere with the person's life. So there's a lot that needs to be done at that stage. Schooling, parenting, and media will be things that I think that we can all begin to push for in our various settings.
So how about the extreme cases? I mean, when you talk about those horrific issues, they come to play when we have extreme cases like bipolar disorder, cases that the ordinary man will probably not understand and attach it to witchcraft or some religious issue. So how can we get people to understand that chemicals are working, things are going wrong in the head, and there can be solutions, but there are steps to it, because it's not just about being depressed or getting that clinical depression diagnosis. We are beginning to see the bigger part of it in this part of the world, and that is where the extremism comes in.
Say extreme cases are not what we think that they are. I live with bipolar as well. I've lived with bipolar for quite a while. I'm on medications. I do therapy from time to time. I live very full, and I wouldn't call it normal because I don't know what normal is. And I'm sure a lot of people do not know what normal is. Normal is what you say it is. I would say that the failure of a person to be properly cared for still lies. It's not a failure on the person as an individual, but a failure of the system. That a system cannot identify and prevent and be proactive about people's mental health care is not a burden that the individual with the mental health condition should bear. It is the system. If you have an ideal working environment, you would have mental health care at the primary health care level. People come and they're having malaria every month, and we continue to give them drugs, malaria, treat them. But then we forget that, okay, you know what? Let's begin to have a conversation about how your mental health is affecting your physical health, because it seems like you've had a pattern of recurring type of health condition for a while, and how can we have the conversation? How can we be proactive about that? So that would be what an ideal system would do. Would there still be people who would have more severe cases of mental health conditions? Absolutely. Again, a system that works in terms of health insurance, a system that is accommodating of the fact that mental health conditions are not necessarily flaws and illnesses in how we have traditionally been convinced to think that they are. But when we look at them from the disability or psychosocial or the human rights lens, we look at it as the fact that the environment has not fully adapted to the needs of the person. Think about the fact that maybe somebody with a bipolar condition just generally has certain kinds of cycles that the environment needs to adjust to, but we don't have that. Think about it from a point of physical disabilities as well. If somebody cannot climb up the stairs, does not mean that the person has a flaw. It is that the system has not created a condition where all people can access flaws that are beyond the ground level. And so that's how we like to think about it. It still lies on the fact that we have a healthcare system that is fragmented and dysfunctional. What we're trying to do is that we're trying to work and tweak within it when we're supposed to be changing the entire system by itself.
Yeah. No,
wow. Thank you so much, Hauwa, for enlightening us. I mean, I'm totally blown away this evening. Now, I want to ask, because we have people that live with family members who have to deal with mental illness. Now, how do we begin to pay attention? Because I know a lot of times we have lost we've lost people, and there have been cases where if somebody was paying attention, that somebody could have been saved. So how do people begin to pay attention to the environment? Let's leave what government is not doing well. How can we begin to equip people to be aware, to look out for the pointers? Right? I don't know if I'm clear on that, but how do we begin to make people to pay attention and to help people get the help that they need? Sort of create that supportive environment that begins to help people manage these conditions better.
No, absolutely. I think it's a very good question. We all have personal responsibility and how we're able to care for people. And it starts by being able to even know what to look out for in the first place. And I would say a couple of things, but I also want to be very wary that sometimes people take these things and they take it to the extreme, and then you start going up and down and say, I think this one has bipolar, I think this one has depression, things like that. So I just want to just put that ahead of time as a bit of a caveat. I mean, let's look at depression, which is usually comorbid. It comes with almost every kind of mental health condition. Depression would always come with it. And it has certain kinds of signs that we can all look out for. And I say this because the person that you're looking at may exhibit it differently from another person. So you want to be careful not to just intrude or assume. So one of the things that you want to look at is you want to establish what the person's norm has been. And when we say norm, which is obviously what we're talking about normal, it's a range. So if we speak psychologically, normal is not a point. So when we say, I'm normal, I'm like, what does that mean? It's a range. And sometimes that differs from person to person, but generally speaking, there's a certain kind of body of what a range of normal would be. So you want to look at the person that you have, maybe a loved one, maybe a father or mother, a significant other, and say, okay, what has been their norm? I've known them for like maybe 5-6 years. And this is how they have been. But something has changed. That's where you now begin to look at and check off a couple of things. So one of the things you want to start seeing first off is general low mood and this sense of perpetual sadness. I don't want to call it sadness, but sometimes we lose words. It's almost like grief, but you cannot see it. It's something that the person feels. It's like they're sinking into a dark hole. Nothing excites them, It's not like they're going to stop laughing or anything. It's just that can't be sustained. So we see that more hours in a day, more days in a week, more weeks in a month. and we see that happening perpetually for a period of time, and you know that something is happening. We also see when people begin to withdraw from social activity. You've had this friend and you know that they're usually the life of the party. They're the person that organizes hangouts. Are you guys, let's go out for drinks and things like that. And all of a sudden, they don't even want to pick calls again when it's girls' night out. Like, they're not even interested. I'm in bed, Jerry. Well, beg, this life, they're just not interested. It happens once. Okay, maybe they're tired. It happens twice, then continues to happen over a period of time. And you're like, there is something there, or they stop picking calls and just resurface after that. Oh, I'm sorry, Jerry, life was happening, things like that. You want to pay attention. You want to look at changes. If you're very close to them and you live in the same physical spaces, then you want to look at changes in their sleep patterns and their eating patterns as well. Are they sleeping a lot more or are they sleeping a lot less? And it's again, it depends on what is normal for the person. If that person is usually somebody that goes to bed at 10, wakes up at 6, very good through their day. But now they are awake at 1 a.m., pressing phone, scrolling Instagram, they can't sleep, they're tossing and turning. I see some people side eyes, and or they're waking up too early and they're like
hold on. Because I was going to ask you that, please. How can we differentiate between stress and mental health issue? Because see, if your environment is stressing you, sometimes I stay awake when I'm just stressed. You understand? And the way I can declutter is probably stay up and watch a movie or something. I was just going to add quickly because we're running out of time. I want you to just lump everything together. The role of religion and culture. That one, it can never be overemphasized. Every time we have the opportunity to talk about mental health, we need to always talk to our religious leaders and our culture, the culture that this person is supposed to stay silent, don't speak up and all of that. And men are not supposed to cry, all those kind of, horrific, what's it called, programming that we've been programmed to be. So you just see a man throwing a lot of tantrums. You don't know why he's throwing tantrums. He's going out to go and take alcohol because that is his own way of escape. And, so that's what is happening now, because if they say that we are number 6 in the world of the highest consumers of alcohol and drugs, that's a big deal, Hauwa. It's a big deal. So how can we... TikTok challenge. TikTok challenge for you. So what do we do quickly?
So it's a lot, and that's why there's such an urgency, and if Nigeria doesn't get on board very quickly, this might be a missed opportunity. I think COVID-19 has given us a very clear opportunity to see that mental health affects all of us. If we ever before didn't think that it's my problem, it was only for people with mental health conditions. Now we can all see that the thing affected me last year, or I remember, and things like that. So I think it's really, really important. And it goes back to some of those things that I talked about. But I also want to clarify that it's not just about having one of those things. It's about having at least 3 to 4 of those things over a combination of those kind of signs over a period of time, so that you don't feel like just, it happens maybe one time in a month and they're like, hey, God, what have I carried on my head? That kind of thing. But it's also, and that's why it's so important that we know these things early so that we can intervene early. We can begin to seek support early. There's so much about, like you rightly mentioned, culture and religion. The cultural, I don't know why we are so determined to hold on to things that are no longer working for us. But what can happen with culture is that when a group of people begin to, break that culture, and more people are beginning to share and open up and be vulnerable, more people see that it's almost like they have permission to do the same now, And so I think at the beginning of the show, we're talking about how people are sharing and, while sometimes it may look like oversharing and things like that, the truth is that it now opens the door for other people to begin to now express and let down and let out and things like that. There's so much for the fight for, against patriarchy and all of that, because a lot of men are stuck. Whilst more women may present with mental health conditions, more men, statistically speaking, actually carry out suicidal thoughts and actually go ahead to take their own lives. And, the cases are a bit more violent and, more cases of substance abuse and, and alcohol involved as well. So there's a lot of the conversation that can also be taking place, that can also take place in churches and mosques and religious institutions. Our traditional leaders, people listen to them. So I always tell people, we have to look at how to influence our influencers, because that's the only way we're going to scale the message across board.
Absolutely. I love that. Influencers. Yes, fantastic.
Why are you pointing out?
You say you had one final question.
Okay, I wish you had more time because I was going to share something to get your opinion on it. But taking it back to maintaining mental health and national challenges, October 20th is around the corner, and I know how I felt last year. It was one of those experiences that actually shaked me. like is it shook now?
Shook you. Yeah.
It shook me. And it's happening again. People are wanting to commemorate, and the governments are pushing back. So what would you say to the young ones out there? How can they maintain their mental health in this period? What would you tell them to hold on to while trying to at least have a voice?
I would say it's really tough. It's tough because when you're in a mentally unhealthy environment, you cannot self-care your way through it. And it's something I try to emphasize. You know, we tell people, oh, do this activity and all of that, but we forget that that's a bit privileged because we have the opportunity to go home to very nice houses where there's lights, or we can turn on the generator, we can sleep soundly at night. There are people who genuinely do not have that privilege. And that's a fact. So whilst we want to say, you know, try and sleep, try and switch off if you can, try to be very deliberate about the information and the news that you consume. If you need to stay off social media for a while, please do that. We recognize that the issues with regards to Nigeria, the national challenges are staring at us offline as well. So you can run away from it online, but you can't run away from it offline as well. You know, so you open your tap, it's dirty water, there's no light for days, you go on the road, they want to extort you, prices of things are going up, it's hard. You know, so I would say know what is within your control, know what is not, and try to put all your effort on what is within your control.
Absolutely.
We have a 24/7 helpline, and we're here to support you.
Yeah, I was going to say quickly, can you please share, because it's important for people to understand that they can find help. You know, I love the idea of the helpline. Having 7,000 call logs is not a joke. So can you please share the number again for the people that are watching that really need to speak to someone?
Thank you. It is 0800 800 2000. 0800 800 2000. So 0800 800 2000. It's a 24/7 line. It's toll free, so you never have to worry about your credit. And you know, you get to speak directly with a trained professional, a counselor actually, and you can do it on the phone. You can call as many times as you want to.
So 0800
800
2000.
Yeah.
All right. Thank you so much, Hauwa. I think we need to bring you back again because I really wanted to touch on the impact of social media on mental health, because that is a big deal. And we are all on social media, and it seems like we are all struggling to want to impress. But thank you again, Hauwa. It's been an amazing conversation. We hope to have you again soon. We'll need to keep the conversation going. All right, so thank you, ladies. Thank you, Norma Ifana. Thank you, Elsie Godwin. Now, before we go, do ensure you follow us on Instagram at PlusTvAfrica. You can interact with us further, drop a comment, and more importantly, we're planning a giveaway to say thank you to you for believing in the Ways brand. So do well to follow us now. It's at PlusTvAfrica. Like, share, comment, and invite your families and friends to watch and follow the conversation. If you missed today's quote, here it is again. You can't control everything. Sometimes you just need to relax and have faith that things will work out. Let go a little and just let life happen. I think Hauwa also mentioned that some things you cannot control, so you just let go. All right, we'll see you guys tomorrow at 8 p.m. as we bring another great conversation to your screen. Enjoy.